I'm Jennifer Tyner. I'm the lead care manager at Aging Outreach Services, and this is All Things Aging.
And I'm Amy Phariss, Editor-in-Chief of Outreach NC, our monthly publication. And today we're talking about getting a proper dementia diagnosis. So this comes up a lot.
It does.
In fact, last night I was talking to somebody who said, I think my mother is developing dementia. It's getting really frustrating, but there are no resources and I don't know what to do.
Oh.
And so it's relevant.
Did you say I had a care manager
I
that can
did.
help you?
I said I might know somebody.
Yeah.
So let's get into first, what are the early signs of dementia that we should be looking out for?
A lot of people think that those signs are like, misplacing your keys or forgetting someone's name or forgetting where you left your drink at a party. But really the big things are when you forget you went to the party, or you forget that you know that person, or when you find your keys, you don't have any recollection that that's where you put them. So having some issues misplacing things, forgetting things, being repetitive, difficulty doing day-to-day tasks, things that are normally really easy for someone, when they start having difficulty doing those things. Of course, getting lost when you're driving, that's one of the early signs. When they start to get confused about place and time, that's another one. And then a big one that we see a lot that people don't associate enough with the brain change of dementia is that loss of interest in common activities, things that they enjoy, just the apathy, isolating themselves. They realize that there's something wrong, and they know that going into those normal environments, somebody else might recognize it, so they start to cut back and not do things that they used to do. So those are some of the things we look for.
What are can you give me an example of like a daily thing that would become difficult, like cooking?
Yeah, cooking, keeping up with your calendar, forgetting your doctor's appointments, maybe putting on the clothes in the wrong order, like they have their bra on the outside of their shirt, or, something that they would normally never do, and they've forgotten how to tie their shoes properly, or that they normally would mop on this day and they've forgotten how to do that. It's not a physical limitation, it's just that they've forgotten the process.
Okay, all right. Which types of dementia are most common, and how can they be distinguished from one another?
Oh, that's a good question. So the most common type of dementia is Alzheimer's type dementia. And then dementia is just an umbrella term. It's a term, used for a group of symptoms, so it's not actually a disease. So lots of things can cause dementia, and there's over 100 subtypes of dementia, and there are reversible types of dementia and there are irreversible types of dementia. So the most common irreversible type would be Alzheimer's. You would see vascular dementia, Parkinson's related dementia, a mixed dementia, like a combination of different things. But then there are irreversible kinds of dementia, and the most common form of that is actually depression.
I was going to say, the symptoms that you were describing overlap a lot with depression.
They do overlap a lot. So we frequently will have an older client who really has some depression issues, but they've been misdiagnosed as having dementia. Because they didn't have the proper testing leading up to what needed to be given the right diagnosis. They were put on the wrong medicine, that kind of thing. But, an infection, pain, anything like that, a change in environment. When we see hospital delirium a lot, so somebody would be completely normal in their home, they go to the hospital, that trauma of being there, that change in environment can cause some of those same symptoms, but it's a delirium, so it's something that can be reversed.
What specific tests or assessments are used to diagnose dementia?
Well, a proper diagnosis would be you'd meet with your primary care doctor, and you would have blood work, a urinalysis, a chest x-ray. You would give them your complete medical history and a family history, because it's really important for them to know what things might run in your family. And then you would want to have an evaluation by a psychiatrist to rule out depression, to rule out any other mental health issues that might be causing some of those symptoms. Then you'd want to meet with a neurologist and have a scan of your brain to rule out a tumor, a stroke, whatever might be going on. And then finally, neuropsych testing to sort of pinpoint what's actually causing that specific kind of dementia. So if you have all of those things done, you have a great accuracy in diagnosing the proper diagnosis of what is causing the dementia symptoms, whether it's reversible, irreversible, and what medicines to take, that kind of thing.
So that kind of assessment is reliable.
It's very reliable. It is. It's just, it's so difficult right now to find the right team of people to put together all those steps to make sure everything is done so that you can get that proper diagnosis.
And so it starts with your primary care doctor.
Starts with primary care, and it really starts with yourself and really advocating for yourself or your loved one. If you notice changes, we often see like spouses compensating for each other, you know, so they'll go to the doctor's appointment together and he'll say, how are things going? And both of them will be like, we're fine. And really they're not. They really have noticed things, but they don't want to upset their spouse or they don't want to upset mom or whatever. So really just, you know, having somebody there to be your advocate and advocating for yourself and not letting the primary care doctor diagnose you. They don't have those, they don't, you know, you can't get that final diagnosis just by seeing your primary care doctor.
So what if you're experiencing these symptoms or your spouse is? You go to primary care and they say, well, this sounds like depression. Then what would be the signs that it's more than depression? You'd have to do more testing to get that actual diagnosis. So hopefully if your primary care doctor thought it was depression, they would refer you to mental health for some therapy, possibly even a psychiatrist for medication management, that kind of thing. But if you went and had those assessments and they said, oh, I don't really think it's depression, it might be, you know, bipolar, it might be schizophrenia or whatever, or this is not a mental health issue at all, you know, you need to go see neurology. But just going through all those steps, making sure that you don't just stop at one diagnosis from one doctor, making sure that you've seen the whole gamma. Okay. How can we ensure that any potential diagnosis is accurate, and we've talked about this, not confused with something like depression or medication side effect?
Say that again, I'm sorry. Sorry.
Basically, how do we make sure that the diagnosis is appropriate and that it isn't a medication side effect?
Sure.
Or, for example, you were talking about a change in environment or a trauma. Let's say that, I don't know, there was a death in the family and that isn't brought up in the appointment, then it could be viewed as dementia when it's depression or depression when it's dementia. So how do you avoid that?
Having somebody there to be your advocate, making sure that you're asking the right questions. We have those little doctor kits where we ask have our clients write down in advance their questions, communicating with the doctor, and just having a good team around you, people that really care about you and understand what's going on. So that they can advocate for you. I can't tell you how frustrating it is when we have a client who's got that diagnosis and their first words are, don't tell anybody. You know, don't tell my husband, don't tell my daughter, you know, I don't want anybody to know. It's really important for everybody to know so that they can help advocate for you to make sure that all of your needs are met. And then finding the right professionals to, make sure you're going in the right direction.
So it's not just getting the diagnosis, it's what you do after the diagnosis that's important.
Yeah, it's very important.
What role does your medical history play in the diagnosis?
Genetics can play a role in some of the types of dementia that you might be able to have. One of the types of dementia is alcohol-related dementia. So a history of alcohol or substance abuse affects your brain, obviously, and can cause changes. So it's important for you to communicate that with the doctor. If you've had a history of a stroke or your dad passed away in his 30s because he had a massive heart attack or a stroke, you would want your doctor to know that information because a lot of that's genetically linked. And it's really important that your doctor knows all the medicines you're taking. When we talk about bringing your pill bottles, we mean everything, not just the prescriptions. I have a lady who takes 2 prescriptions, but she takes 14 vitamins. So it's really important for your doctor to know everything that's going in your body and being able to have all the details.
Especially that would be important in seeing if anything recently has changed with a medication or a supplement or even in your life.
And even not taking your medicines appropriately can cause some issues. You can find, you take all the medicines you got from gastroenterology and cardiology and neurology and primary care, and then you get them all in one spot, and they go, oh, well, this interfaces with this, and this interfaces with that, and that could be causing some issues in itself, just a med issue.
That's true. I was recently taking a med that they said to take on an empty stomach, which I thought was a suggestion.
Oh, no.
And it turns out it was not a suggestion. So how important is early diagnosis?
It's very important because the earlier that you can be diagnosed, the more accurately it can be treated. So medications that they have right now for those that have been diagnosed with dementia work the best in those mild stages of dementia. And there's different medicines for different levels, but nothing helps in the severe stages.
Okay.
So only mild and moderate's been approved for meds. So it's really important so that if you want to start on medication, if that's your choice, if you want to start on one of the meds that can slow down the progress, it's best to start on that as soon as possible. But it also is really good for your family to be able to create a plan and talk about future. If you have a diagnosis that has a poor prognosis, you want your family to know. You want to be able to make a plan. If you have alcohol-related dementia, what are the things that come along with that? Like, am I going to be able to stay at home, or am I going to need to be placed somewhere? So it's just really important to get that diagnosis as soon as possible so that you can create that life plan that you need so bad.
So you talked about the multiple doctors and healthcare professionals. When does cognitive testing come into play?
That final cognitive testing should be after you've had your primary care doctors done all the basic lab work and medical history, after you've seen the psychiatrist and ruled out depression and mental health issues, and after you've done brain scans with neurology. And your primary care can, order those types of scans, but after that's done, because the neuropsych testing, the cognitive testing that you're talking about comes into play. All that information also needs to be gathered for that testing. So if you have that done in advance, once you have the cognitive testing, then you're able to just do the testing.
Okay.
So it comes into play later too.
So there really is an order to how everything is supposed to be done.
Absolutely.
How can you prepare a spouse or a loved one for that testing? What do they need to know? Do people ever get nervous about it?
Oh, they get very nervous about it. That it is time consuming and there's no right or wrong. You really want to just make sure you've had enough rest the night before. You try to be as less anxious about it as you possibly can. Understanding the importance of the testing is really a good idea for them to understand. It's really important for us to know what type of dementia you have, and this is the only way we're going to get there. You don't want to have somebody who has Parkinson's related dementia be diagnosed with Alzheimer's, because you wouldn't want to give them the Alzheimer's meds. The prognosis would be different. The stages would be different. The decline is going to be different. So just kind of talking through and maybe having some concrete information for them to see, here's why it's important for us to go through this testing, and here's how we can all work together to make sure that you get the best care possible.
So that diagnosis is as important for the family and the loved ones as it is for the person.
I would say for sure, maybe even more so.
So final question, how can we support our loved one during the diagnostic process, especially if they're anxious or resistant?
Just reminding them that you're part of their team, that you care about them, that you want what's best for them, that you're their support system, that you're supporting them. And maybe it takes a couple tries. Maybe they refuse to do it the first time because they're too anxious, but reminding them that early diagnosis is the best way for the whatever's going on could be treated. And I think just encouraging people to understand that there are things that can be reversed, that you can find out in these tests. I think that sort of helps push people to actually complete the test. It also gives you a really great baseline for, like, if you're in the very beginning stages, it helps them figure out your prognosis later on by having that early testing done and establishing your baseline there, and then they have something to compare it to over the years.
What would you say to a loved one who feels that a diagnosis is like an identity defining thing? I
think that's something that we're culturally working on right now, because it is. I mean, we do kind of look at it and, that person has dementia, and, we don't want people to forget that they're still Amy Phariss. They're still that person. So I think just reminding them of the compassion, to be compassionate, to be understanding, to be patient with them and understand what they're going through, and educate yourself. I can't say that enough.
I feel like I learned a lot.
Good.
Thank you very much.
Yeah, sure.